Dry mouth, the silent warning sign your mouth is giving you today. For 33 years, I thought I was just looking into somebody's mouth and cleaning their teeth. Little did I know that God would show me something much bigger. Every day I looked in the mouths that were telling me stories. Stories of stress, hormonal changes, regret, chronic disease, poor sleep, medications, nutrition, and sometimes stories of hope, which was great. At first, I thought I was just looking at the teeth, but I wasn't. I was looking at people's lives, their habits, their health, their struggles, their victories. Over the years, I realized that something has changed the way that I practice dental hygiene and honestly the way that I think about health altogether. Your mouth is connected to the body. It's the gateway to the body. The mouth was never meant to work alone. We don't often sit down to think about this, but it's really important that we think about our mouth and how it affects our whole body health. Our bodies were designed as a part, our mouth was designed as part of our whole body. And one of my favorite verses is Psalms 139:14 is I praise you because I am fearfully and wonderfully made. So we were given our mouths to serve a purpose in our body that all works together. And the more I've studied oral health, the more I've convinced of this truth. Our bodies were designed with incredible purpose. Every part has a job and every system works together. And today I want to introduce you to one of the greatest parts of your mouth and something you often probably don't ever think about, but it is your saliva. Saliva. Most people never think about how important your saliva is until they don't have enough. So I call saliva the unsung hero in the book. In Beyond the Dental Chair, saliva is the unsung hero because we often think we just automatically have it until we don't have it, and then we realize how important it is. So when I ask patients what do they think about their saliva and what it does, they just say it keeps their mouth wet. But we dig in a little deeper and we come to the understanding that your saliva, to be nutritious, it has to have certain nutrients, but it also can be deficient, and that can cause ill effects in the mouth. So saliva being the unsung hero in the mouth, that means it's very, very important. It quietly works behind the scenes of every minute of every day. It helps to wash away food. It helps to neutralize acids. It begins digestion. Without good saliva, you're not going to be able to digest your food. It also helps to deliver calcium and phosphate that can help to remineralize your teeth, protects your gums, and it keeps out harmful bacteria under control. Think of saliva as your mouth's built-in defense system. You probably never think it, but your teeth certainly do. And when your saliva decreases, your mouth begins to change. And sometimes it's very slowly, and sometimes it can come on in a hurry. Saliva is the unsung hero of oral health. And when it disappears, your mouth loses one of its greatest defenses. So it's really important that we understand saliva and its effect on our mouth and our whole body health. So there are some silent warning signs that you may have never even thought about or realized that I want to bring to your attention. And your body a lot of times will whisper before it screams. And so that's why it's really important that you're watching this video, and I appreciate you sticking with me. Research suggests that 1 in 5 adults have a dry mouth condition. It also increases over the age of 65 years old, where you have increased dry mouth conditions, and women in menopause and postmenopause. So it's really important that we talk about this. I'm seeing women in their 30s with dry mouth conditions. I'm seeing mothers. I'm seeing teenagers. I'm seeing business owners, athletes. I'm seeing school-aged children with a dry mouth condition that have reduced saliva flow or have thick, ropey saliva and are having a lot more cavities. It's not just an adult, older issue anymore. It has all changed for us, and being aware of this is really important. What you may have noticed is more cavities, more gingivitis, sensitive teeth, bad breath, dry lips, burning tongue. Those are a few of the symptoms that you may see or feel that you don't even realize. Even just having water by your bed or waking up needing water. Until you are more aware of this, you may not even realize it. And that's what today's video is for, is just to make you aware of these things. Because I've seen it so much, this is why we talk about it. Your mouth often whispers before disease begins to shout. So a cavity here, a cavity there, but you are considered a higher cavity risk if you've had a cavity in the last few years. And so if you're having cavities consistently, especially if you have gum recession, roots are exposed, you're going to have cavities faster. That is a clear sign that your mouth could be deficient in saliva. You know, I've had patients for years that tell me I brush every day, I floss every day, I use my toothpaste, even those using a high prescription toothpaste or ingredients that they think are going to help. If they don't have enough saliva flow, you are not going to be healthy in the mouth. That includes your teeth for cavity prevention and your gums for gingivitis and gum disease. I'm seeing 20-year-olds with severe gingivitis at this point in the game. That is very concerning. Now, there are other reasons why we talk about that in the book, but one of the main reasons that goes under the radar, I often say, is because of dryness. So why does this happen? Dryness is a symptom. It's not the disease. So we need to recognize that. There are over 500 medications that could be contributing to reduce saliva flow in the mouth. That could be anywhere from ADHD medicine. It could be from anxiety medicine. It could be your blood pressure medicine. It could be allergy antihistamines. I noticed that. Even the meprazole or those stomach acid type medications are affecting us. If your stress is affecting your sleep, if you're breathing through your mouth while you're sleeping because your sinuses are not working or you have allergies or your nose doesn't work well, you have a small airway. And crowded teeth can also make it harder to remove the daily plaque as well. So you'll want to ask, why is my mouth dry? And what is my mouth trying to tell me? Your mouth is a sign, a symptom of what's going on in your body. Dry mouth isn't the message, it is the messenger. So when you notice that your mouth is drier, and I don't say dry, when I said that in the beginning, when I started realizing how big an issue this was to patients on my one-on-one care, they told me they didn't have a dry mouth. And I wouldn't tell you that my mouth is dry, but it is drier as I've started going through the hormonal changes of life. So that's why this video is so important. So another one of my tips today is to keep your lips sealed. So before we finish, I'd like to present you with one challenge. Let's call it the awareness challenge. So today you've been made aware of the drier mouth conditions, the effects they can have on your mouth, disease, your body, digestion. So for the next week, I want you to start noticing, do you wake up thirsty? Do you wake up needing water nearby? Is your water by your bed? Do you wake up in the night to drink it? Do your lips stay sealed comfortably? Can you keep your lips sealed? Or are your lips getting thinner as you get older, like my top lip is doing? And do you often have your mouth open during the day when you may not realize it? I often see this when I'm just shopping or out about people, since I'm more aware of it. And here's the phrase I want you to remember. Keep your lips sealed. No, I don't want you to stop talking, but your mouth was designed for eating and speaking. And when you're not doing those two things, your lips should be sealed. The one habit may influence breathing, swallowing, or oral development, and the health of your smile. I explore that topic much more deeply in my book because it's one of the most overlooked issues of today's oral care. Keep your lips sealed and become aware of how you're breathing. All right, so I want to give you one tip today besides keeping your lips sealed, and that is correct tongue posture. You probably have never heard of this before. Honestly, I had never heard of this as a dental hygienist either until I furthered and advanced my learning. So if you're ready, I would have you to sit up straight in your chair or stand. I would have you locate your tongue. Where's your tongue lying at right now? Is it in the roof, in the middle, or the floor of your mouth? Mine tends to want to stay in the floor of my mouth. And I have these little scallops on the side of the tooth, on the side of my tongue, where they've set in my mouth, before my mouth my whole life, and they develop that contour of the teeth. So this is really important. So sit up straight, tongue at the roof. Get as much of your tongue at the roof of the mouth as you can, front to back, but not touching your teeth. Close your teeth close together but not touching, and lips sealed. Now I want you to take a nice slow nasal breath in with your tongue at the roof, teeth apart, lips together. And a slow exhale through your nose. In through the nose, out through the nose, tongue at the roof, teeth apart, lips together. How does that feel? If you did a true, genuine, nice diaphragmatic breath, you're going to get that relaxation feeling, that nitric oxide flowing, and you're going to feel so much more relaxed. So you're going to get some more benefits besides just your oral health. So here's the one thing I want you to remember for today's video. Like and follow if you would, so you can see more content coming out. But also, saliva is the unsung hero of the mouth. And one way to keep that, to make that better, if you have a dryness, is to keep your lips sealed. So really understand that. The earlier we recognize the symptoms, the more opportunity we can to prevent disease. Cavities, gingivitis, gum disease, they're all preventable. We do not have to get these diseases. In the modern world, we don't have to get those. Awareness is your first step, so you got that today. And prevention is always more valuable than treatment. We know that. In today's video, I hope you look at your mouth differently. I hope you're able to start looking at the warning signs. I do share in my book, Beyond the Dental Chair, what your dental hygienist didn't tell you about your mouth, that we have different parts of your oral health. It's not just about flossing and brushing, which most of us are led to believe. So I don't want you to think that's the only way. If you go to www.restarthygiene.com, there are some blogs to learn about. There are one-on-one consultations you can sign up for and register. And you can also sign up for an online course that I have that is cheaper than a meal out with your family that can certainly help more than just you. It will help your family as well to learn more. So, saliva is the unsung hero. Keep your lips sealed, protect your mouth, protect your body, and I'll see you next time here on Restart Hygiene. Thank you so much.